In this educational PowerPoint presentation, we will be examining substance abuse disorders. The Australian Alcohol and Drug Foundation estimates that the harmful effects of alcohol and drug misuse contribute to 6.7% of all disease and injury in Australia. It is also associated with 6,660 deaths per year and is estimated to cost $23 billion per annum. Substance abuse disorder can be defined as a harmful use of drugs or alcohol for non-medical purposes and is characterized by intoxication and the inability to reduce the amount of consumption, leading to dependency. Assessments for substance abuse disorder include a mental state examination, which is a tool used to determine a person's mental state at a particular time. It uses both observations of a person and information that they provide. Urine drug screening. This is used to determine if someone has been using drugs. It is usually required for hospital admissions and rehabilitation programs. However, it cannot detect all drugs. Both subjective and objective data is used to gain information on a patient.
Treatments in substance abuse disorder include medications. Medication administration is a treatment used in the withdrawal process of drugs and/or alcohol. It is used to help manage symptoms of withdrawal such as hallucinations, agitation, and shaking. Medications such as diazepam and thiamine are used in alcohol withdrawal. Naltrexone is a maintenance therapy for narcotic addiction. Other treatments include psychological supports and informal support services. Cognitive behavioral therapy, also known as CBT, is a type of psychotherapeutic treatment that helps patients identify, understand the thoughts and feelings that influence behaviors. Cognitive behavioral therapy aims to increase self-awareness, to encourage better self-understanding, to help recognize negative behaviors, and to improve self-control through developing more appropriate thinking and behavioral skills. Another type of psychological treatment for substance abuse disorder includes motivational interviewing. Motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. It includes 4 processes. Number 1, engaging. This is a process of establishing a helpful connection and working relationship with the psychologist. 2, focusing. Focusing is where a patient works on developing and maintaining a specific direction in conversation about change. Number 3, evoking. This is drawing out at the patient's own motivations for a change, such as reasons why a patient wants to stop their substance abuse. Number 4, planning. This includes both developing commitment to change and formulating a plan of action, for example, attending ongoing recovery meetings. Informal support services such as Alcoholics Anonymous, AA, or Narcotics Anonymous, NA. Both are international mutual aid fellowships with the stated purpose of enabling its members to either stay sober or stay off of drugs. They provide ongoing meetings for members to support them in their recovery of substance abuse disorders.
Substance abuse disorders can have a negative impact on an individual's physical, mental, and emotional health. Substance abuse can affect our short-term and long-term physical health. Potential symptoms may include insomnia, nausea, aches, and pains. It can lead to problems with attention, memory, and decision-making. It also increases the risk of physical injury. It increases the likelihood of liver problems, cardiovascular disease, cancer, obesity, and stroke. Substance abuse increases the risk of developing a mental illness and the potential for experiencing anxiety, depression, paranoia, psychosis, and psychological distress. It is common that a substance abuse disorder coexists with a mental health disorder. Substance abuse may also affect our emotional health, causing problems with our personal relationships. A person may become withdrawn and isolated. It can cause problems with trust and intimacy, and it can cause uncharacteristic mood swings, secrecy, irritability, and anger, leading to a potential loss of relationships with a partner, family, or friends. The social impacts may be difficulty maintaining employment, financial loss, poverty, and even homelessness, additional healthcare costs, potential legal fees and fines, and a reduced participation in social activities. Also, the participation in antisocial activities. The downward spiral of addiction and substance abuse does not only impact the nuclear family, the effects may encompass extended family, friends, neighbours, and co-workers. Crime, violence, housing problems and homelessness, motor vehicle accidents, and economic consequences are some of the negative impacts felt by our community in regards to substance abuse disorders. Recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. It's important to recognise that recovery looks different to each individual. The clinical reasoning cycle is an important tool used for the diagnosis, treatment, and recovery of substance abuse disorders.